Does your hip hurt when you first stand up? Maybe it eases a little bit after you've walked a while or kind of rotated your hips, but it comes back again after you sit for a long period. It's really easy to assume that the pain means something is like deeply wrong, like your joint's failing. But what if the hip isn't failing? What if it's simply forgotten one of the movements it was designed to do? Sometimes the place that hurts isn't where the story begins. So today we're going to explore why so much chronic hip pain has less to do with the damage in the joint and more to do with the way modern life keeps us living and moving in very limited positions. Then I want to share a few gentle movement ideas that will help your hips rediscover something that they've been missing out on because you've been sitting too much. My hope is you leave this video with a deeper understanding of the body and a little more hope about what's possible. I'm Dr. Melanie Carlone. I'm a physical therapist, I'm a somatic practitioner, and someone who believes our bodies are constantly adapting to the way we live. And once you understand and see it, you can really do something about it. Because the body's amazingly efficient. Whatever we ask it to do over and over again, guess what? It gets better at that. And that's wonderful when you're trying to learn a new skill or you need it to be a certain way to do something in life. But it's helpful if the skill you've been practicing starts to put you in a deeper hole, and that can come from sitting. So think about your average day. You're driving, you're working at a computer, you're eating, you're watching television, scrolling on your phone. Much of modern life happens with our hips bent, and we evolved not with our hips bent. And the body notices that, and eventually it starts organizing itself around that flexed hip position. One of the most important movements your hip makes is walking, is extending. That's simply when your leg moves behind the body. Every comfortable stride you take depends on it. Climbing hills depends on it. Walking with ease depends on it. Even being able just to stand up tall. Your glute muscles, your hip flexors, your fascia, they all have to work with that extension movement. But if you spend hours every day with your hips flexed, extension gradually becomes less familiar. Not impossible, just less available. And over time, that makes a difference. The body doesn't forget how to extend right away. It slowly stops. So if your hip loses extension over time, something has to compensate. What's compensating? The body loves completing tasks. So if one area contributes less and you're asking it to stand up, another area has to contribute more. So if your hip no longer extends well, many people start to extend the low back or the mid-chest. And at first it works beautifully. You keep walking, you keep gardening, you keep doing the things in life, but eventually the low back starts to work harder. The mid-back starts to work harder, and the front of the hip feels even tighter. And walking starts to become more limited, shorter. Standing up makes you stiff. Not because your body failed, but because it's adapted and you haven't addressed the adaptation. Which makes me wonder, why would the nervous system choose that strategy in the first place? Well, one of the really beautiful things about the nervous system is it loves familiarity. When something keeps happening over and over, if you've spent years living, working with your hips bent, the body believes that's where home is. It wants to help you be more efficient. So the tissues in the front start to tighten, the muscles in the back get a little less active, a little quieter. Even your posture begins changing. And then people think, oh, I just need to stretch harder. And sometimes that helps, but only for a few minutes. If the nervous system still believes in its firing, that flexion is the safest, most familiar place, it'll naturally return there. So, instead of trying to force the hips open, what if you simply find ways to remind them that they know how to extend and extension makes sense? So before we move on, I want you to try something. If you've been sitting for a while, stand up now and notice. What happens at first? Do you immediately stand tall? Can you tighten your glutes and stand up straight? Or do you stay bent forward for a few steps? Are your hips and knees kind of stiff? So leave a comment and let me know, because that first moment tells you a great deal about how your hips are organizing your movement in everyday life. So these are some movement ideas I want you to explore, and feel free to adapt them, what feels right for your body. Learn to keep tuning in to what's right with all that input out there. So let's start with a quick baseline. so you have something to compare to at the very end. First, I want you to stand facing a countertop or a chair for support, and slowly allow one leg to glide behind you. And just notice how much extension are you actually able to get deep in the front of the hips. Notice without judging it. How does it feel? Does it stop early? So gently set it down, switch sides again, and just notice, can you extend your hips? We're going to come back to that in a few minutes. All right, so let's do a hip flexor hack. I want you to gently turn your toes in towards each other, tuck your tailbone slightly, lift your pubic bone, and you're going to bring your hands onto a wall and kind of lean into it, all right? Isn't about pain. You don't have to do it hard. Toes in, tail tucked, hands on a wall, lean in. And lift your kneecaps. Tighten the kneecaps, tucking the tail, opening the hip flexors, toes turned in, and breathe. And you're going to hold it for a minute. And just notice, keep the weight even on your feet, heel, ball the little toe, ball of the big toe, toes touching, tail tucked, and leaning. And breathe deep into the low back. Okay, keep holding it, keep breathing. Notice what you feel. What is that like? Now, step away, undo your toes, put the weight even on your feet, and just notice. How does it feel in the front of the hips? How does it feel in your legs? Now, again, push one leg behind you and go to the other side. Did it move a little further? Did it feel a little more familiar to bring your leg backwards? There's no right answer. It's just information from a nervous system that had a moment to tune into the tension and then the relaxation. So rather than stretching aggressively or people getting their hands in deep for psoas release, which can help, how about inviting the hip to remember the movement it's designed to do? Because one of the biggest misconceptions about hip pain is that the answer is always stretching. And sometimes flexibility isn't the missing ingredient. Sometimes variety of movement is. Because your body thrives on options. It wants to go the hip forward, backwards, rotation, walking, reaching. And when you can restore options of movement, the nervous system often discovers it doesn't have to protect quite so much. And that really can make a difference. So start to break it up in your day. Start to give opportunities for different movements to feel easier again. Because if your hips have been asking for your attention, which is what pain is, today's conversation can give you a different way of listening. Bring that movement in. And that hip flexor hack, it really works. Your body isn't punishing you for sitting. It's adapting to what you repeatedly ask it to do. And the beauty about adaptation is it works both ways. Do gentle, consistent movement, open up those hips, and the body learns new patterns just as beautifully as it learned the old ones. So, if you tried these movement ideas, I'd love to hear what you noticed. Did standing feel different afterwards? Could you extend your hip? Did your stride change? Walk around a little bit. Do your hips feel a little freer? And leave a comment below. And if this video helped you see hip pain from a new perspective, like it, subscribe, do the thing, and move with kindness. Move with compassion for yourself. Breathe with awareness, and remember, the body doesn't stop moving because we get older. It stops moving because it gradually loses options, because it's trying to help you. It's doing what you're asking it to do. And those options can widen and be rediscovered. And that's how we're designed. Have a great day, you guys. See you again.